host for today's event, and to welcome you to the Polytechnic campus as we celebrate some momentous news regarding the Red Deer Regional Hospital expansion. This is indeed an exciting day, and I cannot begin to express how intensely grateful and thrilled I am for this day to finally come. I would like to begin by introducing a number of very special guests whom I have the honor to call my colleagues and my friends. First, one of the hardest working men I know and someone who cares so very deeply for Alberta, the Honourable Premier Jason Kenney. We also have our brilliant Minister of Finance and President of Treasury Board, the Honourable Travis Taves. Also with us is the unshakable Minister of Health, the Honourable Jason Copping. And the on-time and on-budget Minister of Infrastructure, the Honourable Prasad Panda. We are also very honoured to have with us today the Mayor of Red Deer, His Worship Ken Johnston, the MLA for Red Deer South, Jason Steffen, the MLA for Innisfail-Sylvan Lake, Devin Dreeshen, Deputy Mayor for Red Deer County, Philip Mazier, and the Chief Zone Officer and Alberta Health Services, Janice Stewart. And I'd also like to extend a very warm welcome to all of you and thank you for joining us for today's announcement. Red Deer, as the third largest city in Alberta, is a vibrant and growing community whose citizens are passionate about improving healthcare in central Alberta. Integral to this goal is the expansion of the Red Deer Regional Hospital. Everyone, but everyone, including myself, have stories to share about this hospital. Most reference the outstanding care administered by amazing doctors, nurses, and staff whose dedication in the Central Alberta Zone is unparalleled. For me, the precious memory of the birth of each of my 7 children at the Red Deer Regional holds a special place in my heart. While other experiences could be classified as humorous, such as the time that my husband broke his wrist a number of years ago and needed immediate surgery, but the only way he could be admitted, due to the shortage of beds, was to admit him to the tub room. A room, yes, with a tub so small you had to angle the bed to close the door, and his meal was served over a tray which was all over top of the toilet. This would indeed be really funny, except for the fact that I understand this tub room is used almost every day for overcapacity space. And then, sometimes the experiences are just plain heartbreaking, and unfortunately I have one of those as well to share. In October of the year 2000, my father-in-law, who was gravely ill, had to be admitted to an observation room while awaiting a bed to become available. The room was very small, and our very large family and extended family struggled to say our goodbyes. After 2 days, a bedroom finally became available, but unfortunately, my father-in-law passed away in the hallway as he was being transferred. I cannot tell you how devastating that was. While these are a few of my experiences, I can share that I continuously hear from constituents with their own stories and experiences. And the expansion of the Red Deer Regional Hospital is undoubtedly the #1 infrastructure issue in central Alberta. Study after study and report after report confirm how desperately this expansion is needed. So now, without further ado, it is my great honor to invite the Honourable Premier Jason Kenney to share his remarks.
Thank you so much, Adriana, for those moving words and, more importantly, for your incredible hard work on behalf of the people of Red Deer, your constituents, and Albertans as Minister of Education. Thank you to the newly renamed Red Deer Polytechnic for welcoming us here today, and congratulations on your recent receipt of degree granting status. We're so excited about the future of this great institution of post-secondary learning. Thanks to everybody from the community welcoming us here today. Again, Adriana, for your incredibly hard work, for being such a persistent voice for this critical project. Thanks as well to Ministers Tays, Copping, and Panda for joining us, and MLAs Stefan and Dreeshen. Thank you very much, Mayor Johnston, for welcoming us here with members of your council for what is going to be a historic day for Red Deer and for Central Alberta. In yesterday's throne speech, the government emphasized that increasing healthcare capacity is a key priority for Albertans. If there's one thing we've learned through the past 2 tough years of COVID, it's that we need greater value for money in our healthcare system. We need more beds. We need more capacity, because too often we've had to turn to damaging restrictions in order to prevent our hospitals from overflowing. You all know what that means more than most here in Red Deer because of the stories that Adriana just shared of her family. Too many families in this part of the province have gone through adversity in getting adequate care for their loved ones, despite the often heroic efforts of our frontline healthcare workers, who we all are so grateful for, particularly for their remarkable service over the past 2 years. We have heard again and again that Central Alberta needs a significant expansion of the Red Deer Regional Hospital capacity. And in tomorrow's budget, Travis will present a historic investment to increase healthcare capacity in Alberta. An increase that is only possible because of a growing and dynamic economy, which he will also underscore in tomorrow's budget. But that brings us to today's announcement. I am pleased to report that tomorrow's budget will include the single largest taxpayer investment in the history of Central Alberta and the single largest hospital expansion in the history of Alberta's healthcare system, with a $1.8 billion commitment to the renewal of the Red Deer Regional Hospital. This is a banner day. This is an historic day. Mark it down, Red Deer, as an historic day for this community and its vital future. The $1.8 billion multi-year expansion and renewal of the Red Deer Regional Hospital Centre will begin with a commitment of $193 million in spending over the next 3 fiscal years. And this will include 200 new inpatient beds, increasing hospital capacity from 370 beds to 570 beds, or by 54%. The expansion will also provide for new operating rooms, increasing surgical capacity, and yes, a new cardiac catheterization lab will be included in this project. I want to say thank you to Red Deerites and Central Albertans for your patience. You have been fighting for this expansion for years and years. Previous governments didn't listen. And this government took office facing a fiscal crunch. But we found the first $100 million commitment that we announced 2 years ago, pre-COVID. And now this is at the very top of Alberta's building program as our top healthcare priority. And this is not just about Central Alberta. Every additional bed that we are able to open here in Red Deer and Central is an additional bed in the entire Alberta public health care system. You know that through the peak of COVID waves, too often we had to transfer patients out of this hospital, sometimes by Medivac, to Calgary and Edmonton because the ICUs were overflowing in the hospital behind me. And in the future, that should never happen again. Instead, this will be a major regional hospital that can help the smaller hospitals in the communities of central Alberta when they're coping with too much pressure. This is a big deal for healthcare for decades and generations to come, all through central Alberta, and it is a critical part of our overall strategy to increase healthcare capacity. That capacity means building, creating new beds. It means investing, particularly increasing the baseline capacity of intensive care units across the province. It means increasing the number of surgeries that we perform through the Alberta Surgical Initiative, through a smart reform that will have more publicly insured surgeries performed in chartered facilities so that we can reduce the wait times and get people the care they need within clinically acceptable timeframes. It includes hiring more staff, particularly in key positions throughout the system. Alberta is already, despite a great fiscal challenge of recent years, Alberta is spending more today on public health care than at any time in our history. We have more nurses working in our hospitals and more doctors in our healthcare system than at any time in Alberta's 115-year history. And with the budget tomorrow, you will see even more historic investments, again, in staff, in capacity, so that the system is there to respond to the needs with world-class care. As the throne speech said, we have to learn from the lessons of COVID. We have to be honest about some of the shortcomings of our healthcare system, despite the great and often heroic work of our frontline workers. Here's the reality. When our government came to office in 2019, according to the Canadian Institute of Health Information, we inherited a healthcare system with the lowest number of per capita intensive care beds in Canada, with some of the longest surgical wait times in the country. And that is in a system in Alberta with the second highest per capita health expenditures in a country that has one of the most expensive healthcare systems in the developed world. We must have the courage to ask ourselves why we have fewer physicians and nurses, ICU beds, and beds in our acute care beds per capita than many countries that spend significantly less relatively on healthcare. We need to be open-minded and bold, not ideological in how we approach that. And that will be reflected in tomorrow's budget. And as we move forward with our bold strategy to increase healthcare capacity. But that starts here today in Red Deer, in central Alberta. Once again, thank you to all of the folks at Red Deer Hospital for your brilliant work under trying circumstances. This will be a time-consuming project. You don't build or massively expand an existing hospital overnight. But this has been a plan that we have been developing in close and careful consultation with the local community, obviously with the practitioners at the hospital, with Alberta Health Services, Alberta Infrastructure, Treasury Board and Finance, have spent much of the past 2 years developing this plan so that we are ready to go forward and do everything we can to open up this additional capacity as quickly as possible and to do it, Prasad, on time and on budget, right? And let me close with the point I made earlier, that investments like this are not possible with a stagnant economy. Investments like this do not happen if investors are fleeing our province. Investments like this don't happen when the economy is stagnant and revenues are declining. Investments like this to improve our quality of life and critical health care are only possible when there is a dynamic and growing private sector economy, when entrepreneurs are investing to create jobs, and those jobs create additional tax revenues, and those tax revenues help us to make investments in key public services like this. And so you'll see that linkage in tomorrow's 2022 budget. You will see that Alberta is getting its finances in order only because we made some difficult, and I'll say it, unpopular decisions to get our spending under control. We went from annual spending increases of nearly 5% a year to annual spending increases of almost 0% a year in the past 3 years. If we had not made those tough and often controversial decisions, we would not be in a position to make investments like this today. And if we had not done things like reduced the tax rate on job creators, reduced red tape, and adopted the Alberta Recovery Plan pro-growth policies, we would not be seeing revenue growth across all sectors, industries, and regions of the province. We must keep our eye on the ball of economic growth and job creation so that we can pay for projects like this $1.8 billion historic expansion of the Red Deer Regional Hospital. Once again, the single largest taxpayer investment in any capital project in the entire history of Central Alberta. A great day for Red Deer, a great day for Alberta. And with that, I look forward to more details from Minister of Finance Travis Toews.
Well, thank you for that, Premier. Minister LaGrange has done a great job of setting the stage for the great need for additional healthcare capacity in Central Alberta. And I have to say that this announcement today is more than about just Red Deer or about the region. This is about expanded capacity throughout the province of Alberta. As an enhanced capacity here in Red Deer will take pressure off of Calgary and off of Edmonton. Again, Minister LaGrange did an excellent job of sharing some personal stories about the great need here in Red Deer itself. The Premier did a great job of talking about the specifics of the hospital, and I expect Minister Copping will do a little more of that. So for me, I'm just privileged to join with you today in this historic announcement. I do want to underline a couple of points the Premier made, I think important points for us as Albertans to consider. How are we able to pay for important projects like this? How are we able to sustain a world-class healthcare system in this province? And we will talk more about that tomorrow in Budget 2022. But I would suggest there are two key approaches that are necessary, that have been necessary to date to get to this announcement today and will be necessary in the future to ensure sustainable healthcare delivery, sustainable government programming down the road for future generations of Albertans. The two principles are this. Firstly, we need to continue to ensure that we're providing the most cost-efficient government possible. That includes delivering efficiently in our healthcare system, in our education system, and in every aspect of government. The Premier pointed out that we inherited a government spend, an increased trajectory of over 4%, almost 5%. That was on top of a per capita spend in this province of over $10 billion more than comparator provinces. Folks, continuing on that trajectory would have meant an erosion of goods and services, of world-class healthcare to Albertans today and for future generations. I'll talk more about this tomorrow, but we have made great fiscal progress in the last 3 years. We've not taken a Ralph Klein approach. We've taken a surgical, thoughtful, careful approach, and over the last 3 years, we've managed to curb our spending curve down. In fact, we've flattened it out, and that's in spite of increasing the healthcare budget year after year. That's in spite of ensuring that we've adequately resourced health to deal with the pandemic, not holding anything back to ensure that Alberta Health could serve Albertans during this time. Folks, we will need to continue to be very disciplined in our spending decisions. Disciplined so that we can make strategic investments such as this one in Red Deer today. The other principle that we have to continue with, and the Premier put it, I think, better than I ever could, and that is we have to keep our eye on the ball in terms of economic growth, job creation, and expansion of our fiscal capacity. That's absolutely critical. We made a number of moves shortly after taking office to position the province with the most competitive business environment possible. And I've been incredibly gratified, thankful to see announcement after announcement over the last number of months. Major investment announcements across regions and across sectors. Yes, Alberta's economy is diversifying as we speak. Even though we see a welcome strength in the energy sector, We're seeing strength in the petrochemical industry, the aerospace and aviation sector, manufacturing, the tech industry, even film and television, to name a few. And so we're very encouraged with that. So we will keep our eye on the ball. We commit to continuing to deliver most efficiently. We commit to continue to be informed by the 3 fiscal anchors that we identified in Budget 2021, keeping our net debt to GDP below 30%, ensuring a strong balance sheet, and ensuring that we align our per capita spending with that of comparator provinces. I also want to thank the Minister of Education, Minister LaGrange, MLA Stephan, MLA Dreeshen, and their colleagues from Central Alberta who've done an exceptional job in advocating for this region, relaying the need, the great need that Red Deer and Central Alberta has with respect to this health facility. And it gives me great pleasure also to introduce our great Minister of Health, Minister Copping.
Good morning, everyone. It is truly an honor and a pleasure to be here this morning with my colleagues to be able to talk about this historic announcement that we're making today. And this is really, as a Premier and Minister Taves has spoken already, this is really about building capacity. About building capacity, yes, in our fiscal capacity and building capacity within our economy, which enable us to build capacity within our healthcare system. And that's what the budget will be all about tomorrow, is building capacity, including building capacity in the healthcare system. And it starts right here today in Red Deer. So, and I know that there have been many people today who have been awaiting this news, and I'm pleased we can finally share it with you. Over the past few weeks and months, we've seen growing demand for care in Red Deer Regional Hospital, and that demand for increase in capacity. We've seen challenges, and Minister LaGrange outlined some of the challenges historically, and we see challenges more recently about hospitals be able to provide the health care that people in Central Alberta need, and the frustrations that we've had with individuals who have had to go to Edmonton or Calgary. This should be the exception, not the rule. And we should be able to provide healthcare services that Albertans need here in the region and here in Red Deer. And that's why we are taking action today to address this critical need and provide additional capacity in the Red Deer Hospital. Now, with this expansion, we'll have the ability to provide the residents of Red Deer and Central Alberta with improved access to hospital care, surgical services, and cardiac care. More specifically, this expansion will increase the hospital capacity from 370 beds to 570 beds, an increase of 54%, or 200 beds. The expansion will also increase the number of operating rooms from 11 to 14, providing for an additional 3 operating rooms, and it will provide enhanced cardiac services with the addition of a new cardiac catheterization lab. The investment to make this expansion possible is thanks to what we'll be announcing tomorrow in Budget 22. In that budget, again, you'll hear that the health operating budget will hit another record high. We promised we would maintain or increase health funding, and that's exactly what's happening. With the Red Deer Regional Hospital expansion and redevelopment is at its heart. Budget 22 puts a major effort on building capacity in the healthcare system, not only here in Red Deer, but throughout the province. And that includes funding increases to ICU staffing and capacity, but extends to surgery, continuing care, and across our entire healthcare system. My focus as Health Minister remains to support the system in recovering from COVID and doing everything I can to deliver on our promise to increase access to surgery and across the system as a whole. Budget 22 also includes a major emphasis on our need to deliver health care in rural Alberta. And that means supporting existing initiatives and adding new ones to add doctors, nurses to rural Alberta and across our entire province. Because no matter where they live, Albertans deserve the best possible healthcare services, and they deserve this as close to home as possible. And this expansion will enable us to better meet the healthcare needs of this community and assure that Albertans get the service that they need close to home. And lastly, I would like to echo the Premier's heartfelt thanks to all of our healthcare workers for the tremendous work that they have done in supporting Albertans and providing care through 2 very challenging years and managing COVID. And in particular, I would like to thank the staff here in Red Deer and healthcare workers, the doctors, the volunteers for not only providing care, but it is a significant amount of work for the planning for a project this large and this complex. So I want to say thank you to you for not only providing phenomenal care, maintaining surgeries to the greatest extent possible, and providing care during COVID, but focused on this project so you can deliver the services that the people of the Central Region and the people in Red Deer deserve. So thank you so much. And with that, I'd like to invite Minister of Infrastructure, the Honourable Prasad Panda, to provide his remarks.
Thank you, Minister Copping. Good morning, everyone. In fact, as Premier said, today is a great day for Red Deer specifically and Central Alberta generally and broader Alberta communities, especially the rural communities. Budget 2022 is moving Alberta forward by strengthening our healthcare system, getting more Albertans working, and bringing our finances back into the black. And I want to thank Minister Taves for, collaborating with my team in developing and implementing the largest capital plan ever in Alberta's history. And I would like to thank my colleagues, Minister Lagrange, MLAs Stefan and Dreesen, for their constant advocacy on behalf of Central Albertan residents to move forward many important projects, including this $1.8 billion investment for the expansion of Red Deer Regional Hospital. In fact, some of these folks come to my office and to Minister Taves to argue with us about fairness for Red Deer and Central Alberta, and they got more than their fair share because in my portfolio, the largest is Calgary Cancer Center, which is 90% complete, and that is only $1.4 billion. You got $1.8 billion here, more than Grand Prairie Regional Hospital too. So I want to thank all these MLAs for their advocacy, and today is a great day for them to share with their constituents. And this multi-phase project, as Premier said, although it will take a little bit longer in planning because we don't want another Grand Prairie experience, so we are going to plan it meticulously and execute it properly to remain on time, on budget. But it will also increase the delivery of critical services, as Minister Copping mentioned, and it will need much needed capacity in Central Alberta. So as the Minister responsible for infrastructure, I also had to make up the time. Health took in working with us in finalizing the plans. So I would like to thank infrastructure team for thousands of hours they invested in this project to bring it to this stage. And we'll make sure that it will continue to move forward on schedule. I know Premier puts a lot of pressure on us, but sometimes, COVID is something that could, things like that could impact our projects, but so far, touch wood, everything is on time, on budget. And it's not just this project. When you talk about this Alberta Recovery Plan here, our government focused on creating much-needed construction jobs as a counter-cyclical investment. In fact, we fast-tracked and we advanced capital maintenance investments in the last 2 years to create jobs in smaller communities. And I mean, there is no other town I stopped more than Red Deer to share many other projects through Red Deer News Now and Red Deer Advocate, because we don't get much coverage in mainstream. So I spent a lot of time to update projects like Hunting Hills High School, recovery communities, which we were here together with Mayor Johnston a few months ago doing short turning. and Red Deer Justice Center, which is another major project for this area, and the middle school, and also other projects in Central Alberta like Black Falls and Father Lacombe Catholic School. There are so many other projects which Alberta taxpayers are funding. Thank you to Alberta taxpayers. We'll ensure those projects will be done on time, on budget. And every infrastructure and construction related project which is supporting good paying jobs in their communities for local workers is mainly because of the fiscal discipline we followed in recovering and growing the economy. So in the short term, this includes jobs in design, engineering, and construction, and it also includes jobs that ripple out from the construction work site to benefit the Alberta infrastructure, Alberta manufacturers, suppliers, and trucking companies, keeping our friends and neighbors working by supporting jobs and economic activity in the areas coffee shops, grocery stores, and gas stations, as these Alberta businesses see increased traffic from the work that is underway. And even after the construction is complete, these projects will ensure ongoing community-based jobs in programming, operations, and maintenance. The 2022 capital plan supports investments in public infrastructure throughout the province, benefiting all Albertans. These infrastructure projects are building communities, boosting economies, and supporting jobs, making Alberta a destination for companies to relocate, bringing jobs and opportunities with them. That's other metrics. When I go to finance minister for funding of these projects, the criteria is are they going to help recover our economy, grow our economy, diversify our economy, and make lives better for Albertans. So we apply that criteria for all capital funding for projects like this. And that will also help move Alberta and Albertans, like the communities in Central Alberta, move forward to a prosperous future. So in doing so, Alberta will have a bright, thriving, and prosperous future that will firmly secure our place as the economic engine of Canada. With that, I would ask His Worship Mayor Johnston. I don't think he has any more wish list left, because we rolled up all our project all our budget into this, and we exhausted. Thank you, Mayor.
Actually, I do have one left, Minister Panda. I'm doing a kitchen reno, and if you can help me keep it, if you can help me keep it on time and on budget, I would really appreciate that for sure. Good morning, everyone. It's a singular honor to be here representing City Council and the citizens of Red Deer, and by extension, the citizens of Central Alberta this morning. I want to recognize an incredible provincial team that has joined us this morning, and I wonder, after I just mention their names, if you could give them a round of applause, and I'll expand a little bit on how they have helped bring us here today. So we have Honourable Premier Kenney, we have Minister LaGrange, we have Minister Copping, we have Minister Taves, and Minister Panda. Would you give them a round of applause for their effort this morning? And I'm also privileged to recognize a couple of more tremendous advocates in MLA Stefan and MLA Dreeshen, who have not tired in their advocacy, and thank you so much, gentlemen, for your assistance. I will say, ladies and gentlemen, this is a personal issue of mine, and has been for many years. But yesterday, I had the honor of being the guest of Honourable Minister LaGrange at the throne speech delivered by Her Honour, the Honourable Salma Lakhani, at the Government House. Ladies and gentlemen, it was an inspiring speech full of hope and energetic resolve for our promise, and I commend you and your team, Premier, for that throne speech yesterday. I'd like to use a quote from the throne speech this morning. it's a quote that moved me yesterday quite significantly, and I share with you. As restrictions begin to ease here and around the world, and as the signs of economic renewal take hold, we can begin to sense the beginning of an Alberta spring. And nowhere, my friends, in our province this morning is the beginning of an Alberta spring more apparent than here in our beautiful city of Red Deer and in our beautiful area of central Alberta. I was asked a few days ago that if this funding announcement was coming, did I have a word that could describe it for Minister Copping's wonderful communications team? And I said, yes, I said, use the word monumental. Use the word monumental. For today, my friends, is a monumental day in the provision of health care in Red Deer and in central Alberta. As Alberta's third largest region, the Red Deer Hospital Centre is the primary health service provider for our citizens, the central Alberta regional population, and every Albertan traveling along the central QE2 corridor, servicing a population, ladies and gentlemen, of 500,000 people. This is a day, my friends, to recognize the advocacy as well of our medical professionals, our frontline workers, our local citizenry, the mayors and councils of our surrounding towns, counties, and villages, and how appropriate and honorable it is to be joined by the deputy mayors of Red Deer County and Penhold this morning. Thank you so much for coming out. They all spoke, and we all spoke with one voice, with one vision, with one need, a need that has been answered in an extraordinary way by our provincial partners this morning. Thank you again so much. This is also a day to thank our partners in Alberta Health Services for their response, for delivering far more than a world-class health facility to our city, as if that was possible. Ladies and gentlemen, this announcement is life-saving. It is life-affirming, and it is life-changing. On behalf of our council and our citizens and our surrounding neighbors in central Alberta, thank you so much, and we look forward to the vision presented this morning. God bless you all. Thank you.
Good morning, everyone. I am Janice Stewart. I'm the Chief Zone Officer for the Central Zone, and I am so pleased to be here this morning with you. Thank you, Ken, for your kind words about the healthcare system and for the ongoing support that you and your city councillors have provided for Red Deer Regional Hospital Centre over the years. It is a pleasure to be here today on behalf of Alberta Health Services to recognize the tremendous work that those who have been involved in moving this project forward. To say thank you to our government partners for their support, and most importantly, to welcome the opportunities that this investment provides us. While my dyad partner, Dr. Jennifer Bastard, could not be here today, I know I speak not only on behalf of the two of us, but for all of the members of our zone and the site leadership teams in saying that this announcement is the most welcome of news. And it is this welcome not only here in Red Deer, but across the Central Zone, as so many who call Central Zone home in Alberta rely on the specialized care and services of the Red Deer Hospital. Throughout the business case and the future planning work done before, expanding the Red Deer Regional Hospital Centre has been both a goal and a commitment of Alberta Health Services. Over half of the patients that reside in the hospital on a daily basis come from outside of Red Deer. It is our primary referral centre for all of southern Alberta. Here they can receive the specialized services such as radiation therapy, intensive care, advanced surgery, neonatal support, and the specialized diagnostics, to name but a few. It is consistently one of the top 5 busiest hospital sites in the province and is the busiest site outside of Calgary and Edmonton. In recent years, the need for expansion has become even clearer, and this investment today is an important step in us getting closer to that reality. I would like to take this opportunity to thank our government partners for their support in helping to advance this critical project. Thank you, Premier Kenney. Minister Toews, Minister Copping, and Minister Panda. It has been an absolute pleasure to hear this announcement this morning. Every opportunity we had to discuss has included mention of expanding the Red Deer Hospital, and we are grateful for your support. But I would be remiss in not also thanking the numerous times that I have met with Minister LaGrange and MLA Stefan, who have been a big, tremendous support for this project. And I know it was their advocacy that helped us get to where we are today. Both have been steadfast supporters of Red Deer Regional Hospital, and in each conversation that we have had, we were grateful for the opportunity to talk about the hospital and their efforts to help us bring it to us today. I would also like to thank the facility leadership team that are here today, our Senior Operating Officer, Kim Story, and our Facility Medical Director, Dr. Michael Mulholland. Together with their teams and colleagues, dozens of individuals who have contributed to this project thus far, we have heard from many of them. Our staff, our physicians, our facility and program leadership, EMS, community care providers, healthcare providers, patients and families, and patient advocates have all been a part of bringing this business case to fruition. We are grateful for all of the voices who have contributed their experience to planning the facility's future. We look forward to further engagement with them as we work through the functional programming phase of the redevelopment, which has set the stage for the new bricks and mortar. During this phase, Alberta Health Services, along with our health infrastructure partners, will detail the resources, including physical space, equipment, and staffing needs to support expansion in key areas, including new inpatient spaces, which will increase our capacity, additional operating rooms, which we would be ever so grateful for, upgrades in the medical device reprocessing department that supports our surgical suites, and a cardiac cath lab. And I have to say that one is closest to my heart as I'm a cardiac nurse. With the increased capacity, we can help address wait times in the emergency department by helping with additional spaces to admit patients to. We can also have space to accommodate additional surgical patients while they recover. Increasing the number of operating rooms at the site, which already includes 2 dedicated obstetrics ORs, will help us to address surgical wait times when they are operational. We continue to work with our surgical teams to address the backlog of surgeries and to reduce wait times in the interim. And the addition of a cardiac cath lab in the Red Deer site, which has been of special interest to our community, will reduce the need for some patients to be transported to Calgary and Edmonton and to receive their care closer to home. Establishing such a service requires support of infrastructure, including physical space and bed capacity, which we look forward to addressing as part of this announcement. We will also continue to enhance community supports and new clinical pathways as part of the comprehensive strategy for improving the heart health throughout central Alberta that will support the cath lab. There is still much work to be done, but today's investment is a critical and necessary part of realizing the redevelopment that so many of us are looking forward to celebrate at the Red Deer Regional Hospital Centre. There will be continued collaboration with our partners, our care teams, and our patients, engagement with community and patient advocates, and continued recruitment and retention efforts for the additional staff and physicians that will be necessary, and opportunities to come together to help shape the future of healthcare services, not only in Red Deer, but across the Central Zone. And I would be remiss today if I did not also recognize the support of the Red Deer Regional Hospital Foundation, for whom I have known has also advocated for the redevelopment of the facility for many years. They've been a wonderful fundraising partner and have helped us to enhance the care at the hospital over the many years that they've been in existence. The foundation and its donors have helped to fund multiple enhancements at the facility, and we look forward to continuing to work with them as this project moves forward. It's inspiring to know that the shared commitment we in this room have for enhancing the care for Central Albertans through the redevelopment of the Red Deer Regional Hospital. Thank you very much, and with that I'll return it over to the Press Secretary.
Thank you. That concludes the speaking portion of our event today. We're going to move forward to the media. We'll start with the media in the room. If you have any questions, just approach the mic, identify yourself, your outlet, who you'd like to direct your question to, and please stick with one question and one follow-up. Go ahead.
Thank you. I'm Lana Michelin from the Red Deer Advocate. This news is very welcome in Central Alberta. I've been writing a lot of stories over the years over the deficiencies in the hospital. Last budget, I think we were promised $100 million over 3 years. Could somebody please explain whether this will add new money, and if so, how much? And what can people expect to see in the next year or in the next 3 years in terms of actual changes to the hospital?
Thank you. Thank you for that question. First of all, I want to emphasize that this government prioritized this project and allocated $100 million for front-end design work, planning work. In multi-year projects like this, especially when you're trying to expand an operating facility, there are more complexities in decanting and things like that. So I know where you're going at that, but the thing is, it's not an opinion of anyone. It's a budget line item. Last year we had $100 million in the budget. It's written black and white. Tomorrow, our colleague Minister Taves is going to talk about this $1.8 billion, another line item in the budget, so which means there is a predictable funding available for health and infrastructure to spend that as the project progress. So when I talk about multi-stage planning involved, first we had to do business case, clinical services plan, and then functional programming. So we had to consult the health and the local community on needs assessment. There is a process, but it's also supported by the money allocated in the budget. So as we progress, the money is going to be available, but we don't want to repeat the Grand Prairie experience. That's why proper planning and implement that in collaboration with Alberta Health Services and also the local community. I'm sure Minister Copping would like to supplement that.
Great. Thanks, Minister Panda, and thanks so much for the question. So the $100 million that was already done is part of the 1.8. We're announcing 193 over the next 3 years to redevelop the plan. Now, in terms of over the next number of years, as Minister Panda indicated, this is a complex project. We still need to do the needs assessment is done, the budget is done. There now goes to the next phase in terms of detailed planning, in terms of what each specific space needs to, and then to start building. So within the next 3 years, we won't actually have a lot of capacity won't be developed. However, that doesn't mean that we're not continuing to focus on how do we use our current space and increase our capacity in terms of our throughput and be able to provide better services. So that work was ongoing. But the important part about this announcement is the $1.8 billion is committed so that there can be clear work that be done by Minister Panda. We have the money allocated over the next 3 years to be able to do that, and then be able to get the building done so we can increase the capacity. But I can tell you that work within the region already within the existing footprint, and how do we actually increase throughput, increase capacity? How do we increase our surgeries? That work is ongoing and continues to this day. And I don't know, Janice, if you want to speak any further to this? No? Okay, that's it. Thank you.
I do have a follow-up. Is that okay? So in terms of the cardiac catheterization or the surgeries or the beds, will any construction, actual like shovel in the ground construction, start within 3 years with any of that?
So my understanding is yes. The construction will start within 3 years, but I don't know if Minister Prasad, in terms of the, I don't know if we have the detailed, not yet. Okay, we don't have the detailed construction plan, but my understanding that that will happen. There will be shovels in the ground within that period. Shells will be doing up. That's the current timeline at this point in time.
Tom, do you have a question? Okay.
Hi, it's Tom Byrne from Global News. Do we have a time frame then? This $1.8 billion, is this a 10-year project? Is it an 8-year project? Do we know when this capacity will be available to Central Albertans?
As noted in the press release, the entire project will be done by 2030, right? So that is a ways out, but then it's going to be a phased approach. And part of it is the complexity of it, because we're making changes to a running facility. So we need to keep that facility up and running. So at some point in time, we'll build some capacity in certain parts of the project and move people over. There'll be some renovation within the current footprint. So it is a long project, but more capacity will come on sooner than within the 10 years. But we're actually working through that detail as we speak.
I have a question for the Premier on a different topic, if I may. This afternoon, you're meeting with a number of community leaders to discuss Ukraine and Russia. I was wondering, what do you hope to achieve with this? What's the end goal of these conversations?
Thank you. We are deeply concerned about Vladimir Putin's aggression, compromising the territorial integrity and sovereignty of Ukraine. Alberta has a huge and dynamic Ukrainian community, and it's important to all of us that we stand in solidarity with them as they see their homeland and the homeland of their ancestors subject to this kind of aggression that we have not seen in Europe since the 1940s. This is a significant destabilization of global peace and security. We'll be getting a status report from Ukraine's Consul General to Alberta. We've invited former Premier Stelmach, who obviously is well informed and passionate about these issues, and as well as leaders of the Ukrainian Canadian community in Alberta. I will be announcing some financial support from Alberta taxpayers to support civil society in Ukraine at that meeting tonight. And we'll be listening, and I will certainly pass on messages we hear to the Government of Canada. As Canada's Minister of National Defence, I deployed the Canadian Armed Forces to Ukraine in 2015 in Operation Unifier, which continues to this day for 7 years, training thousands of Ukrainian military personnel to be prepared for a moment such as this. I also provided Ukraine access to top-secret Canadian RadarSat intelligence, which was very helpful to the Ukrainian military in defending themselves against Russian incursions in Luhansk and Donetsk in 2016. So I'm intimately aware of the strategic situation. While Alberta doesn't have a defense or a foreign policy, we, as Albertans, should be concerned about this. And I would make one more point. Russia is the largest supplier of oil to the world economy. Alberta is the fourth largest supplier of oil to the global economy. And so our energy security, which affects us, is a very live issue in this conflict. I would, as I did in Washington a month ago, reiterate the inexplicable nature of President Biden's decision to veto the Keystone XL pipeline, which would have delivered 840,000 barrels a day of responsibly produced Canadian energy to U.S. markets, while President Biden is now importing over 800,000 barrels a day of conflict oil, filling the treasuries of Vladimir Putin's Russia, that is fueling this military aggression against sovereign Ukraine. This is unacceptable. And I call on the Prime Minister to make this point clearly and emphatically to the President of the United States, that his decision on KXL can still be reversed. And Alberta can replace Russia as a major source of oil imports to the United States.
Thank you, Premier. One last call for questions from the floor. With that, we'll go to the phones. Operator, can you please put through our first caller?
Thank you. Tyson Fedor, CTV Calgary.
Hi, Premier. Thanks for taking my question here, and a very big day in Red Deer indeed. Unfortunately, I am following up on Tom's question there, just in regards to those sanctions that came down from the Prime Minister last night. Some saying not stiff enough. You mentioned what you did in 2015 as Minister of National Defense. What would you do differently, and does Canada need to bring down stiffer sanctions at this point?
Yes, I believe Canada should. And I was very disappointed when Prime Minister Trudeau's government took office in the fall of 2015 that they discontinued providing the Ukrainian military with a high-resolution top-secret Canadian radar-sat imagery from our satellite network. The president of Ukraine, President Poroshenko, at the time told me that that was by far the single greatest contribution that Canada or any Western country had made to Ukraine's sovereignty at the time, because it allowed them to track Russian-backed military movements in Luhansk and Donetsk. And that had been operationally very helpful to defensive military tactics in 2015. And so I would call on the Government of Canada to renew that intelligence sharing with Ukraine, to provide all necessary defensive equipment to the Ukrainian military, but also to champion the strongest possible sanctions against Vladimir Putin's Russia. If I were the Prime Minister, I would call President Biden to make this point about the veto of Keystone XL, which has only emboldened and empowered Vladimir Putin, who sells 700,000 barrels a day of oil on the global markets. I would, most of that imported, from by the United States. But more than that, President Biden has effectively lifted sanctions on the completion of the Russian Nord Stream 2 natural gas pipeline to Western Europe, which is motivated by desire to make Western Europe more dependent on Russian energy, and it bypasses Ukraine as a transit for Russian gas exports. This is designed to hurt the Ukrainian economy and strengthen Russia's strategic influence over Western Europe. So I would call on the Prime Minister to recognize that he is the head of government of a country with the third largest oil reserves on Earth, the fourth largest natural gas reserves on Earth, and to speak accordingly about the essential issue of energy security that Putin's de facto invasion of Ukraine underscores. So I think those are points that I will certainly raise with the Prime Minister's when I next speak to him.
Tyson, do you have a follow-up?
Yeah, just a quick one. I know you're meeting with the Ukrainian community today. You mentioned some tax money. Do you have a bit of an idea or an estimate on how much you're willing to put up?
Well, we'll be making a meaningful contribution. Look, Alberta doesn't have an international development program, and so we will be making a meaningful contribution. I'll announce that tonight to the Ukrainian Canadian Foundation. That is providing support, including first aid and medical support to Ukrainian civilians, and this is a reliable organization and a partner for that funding.
Thank you, Premier. Operator, can you please put through our next caller?
Jaylen Skolsky, CTV.
Hello, thank you for taking my question. My question is for the Premier or the Health Minister. It relates to the announcement in a throne speech yesterday in regards to an accelerated plan for the Alberta Surgical Initiative. and plans you, the Premier, outlined yesterday to increase private surgeries from 15 to 30% in the coming years. I'm wondering if you can provide a more specific timeline for when that increase will take place and what your benchmarks are to reduce wait lists to determine whether or not this plan is working.
Okay, great question. So in the last year's budget, a year ago, we added $900 million to the baseline budget for health to support the Alberta Surgical Initiative to move, to double the number of surgeries that we contract out to chartered surgical facilities. These are all 100% publicly insured surgeries. Unfortunately, the progress on the surgical initiative has been delayed because of COVID pressures, which have, of course, added to surgical backlogs. But Minister Copping is finalizing a strategy to get on top of that, to reverse those the COVID period surgical backlogs, and then to quickly tackle the long-standing baseline backlog in Alberta surgeries that we inherited from the previous government, which had us on many surgeries outside of the recommended clinical wait times and with longer wait times than most Canadian provinces. So our commitment in the last election was to get all surgical wait times ensure that all surgeries were done within the recommended clinical wait times. Unfortunately, because of the dislocation of COVID over the past 2 years, I don't think we will hit that goal, but it remains our goal to get there as quickly as we can, and we are certainly making the money available for that. We have completed our initial request for proposal, I believe, for orthopedic surgery for the Alberta Surgical Initiative, and the recipients of those contracts will be announced early in March, and I'll invite Minister Copping to add any details.
Thanks, Premier, and thanks for the question. You're quite right. Our government made a commitment to get wait times down significantly as part of coming into government. We have been delayed by COVID, but the Alberta Surgical Initiative, in terms of leveraging chartered surgical facilities, has continued. So we've done RFPs both for ophthalmology and orthopedics. The initial phase of those have completed. Ophthalmology will be that's completed, and we'll be making an announcement towards the end of the first quarter of this calendar year. Orthopedics we're continuing to work on, and that's to be able to provide increased capacity. But as the Premier noted, our focus, and my full focus as we come out of COVID, is not only to catch up on surgeries that were postponed or delayed, but be able to reduce significantly the wait times, because quite frankly, the wait times in this province are not acceptable. And using chartered surgical facilities are one key element to be able to do that, but also leveraging our public facilities at the same time. And that's going to be our entire focus, working with AHS over the upcoming year to get those wait times down. And so, because someone shouldn't have to be waiting for 2 years to get a hip replacement, and that's unacceptable. We will reduce that and make meaningful impact on that. As the Premier indicated, we're not going to get to our goal of everything within clinical wait times by the end of this year, but we are going to make a significant dent on it. We are providing the funding for that, and that is going to be our focus.
Do you have a follow-up?
I do, yes. Switching gears slightly, my question for the Education Minister. In regards to, again, something coming out of the throne speech yesterday, what is the motivation for the decision to open more charter schools in the province? And how do you respond to criticism that this will open the door to privatization of public schools?
Thank you for the question. In fact, we've made a commitment all along to support choice in education. Charter schools are one element of the choice. They have been since 2008, there have been no new charter schools. So the fact that we do have now 3 new charter schools, there's a few more applications that are in. This will not detract. This will further enhance education choice in Alberta. But we are also making a commitment to all of education, and you will see that reflected in the budget.
Thank you. We have time for one more question. Operator, can you please put through our final caller?
Audrey Deneveau, Radio Canada.
Hi, thanks for taking my question. My first question is for Premier Kenney. I'll ask it in English if somebody else wants to add on, but AHS published a report in 2015 saying that the Red Deer Hospital was missing 96 inpatient beds and 18 emergency beds. But this was 7 years ago, and the completion of this project is going to be in 2030, 2031. So there's almost a 20-year gap in between. Aren't you a little scared that by the time you complete the expansion, we'll already be at capacity again and we'll be in the same problem over again?
Thank you, Audrey. I can't explain why the previous NDP government did not take those warnings seriously. They chose not to prioritize this in their capital plan. They didn't put 1 cent forward for additional capacity in the Red Deer and Central Alberta Hospital here. We've made a different decision. We, in our first year in government, made available $100 million to begin this huge project, and now this is nearly $2 billion in the single largest investment in hospital expansion in Alberta history, the single largest capital investment in central Alberta history by Alberta taxpayers. Now, I wish we could snap our fingers and open up these 200 plus extra beds tomorrow. But the reality is when you're dealing with a building onto an existing hospital, it's extremely complex. And as Minister Panda said, we have to build an additional facility, move patients into that, then renovate the old portion of the facility, and do that in 3 or 4 phases. It's like building an airplane while it's already taking off down the runway. It is a very complex project, and we are determined to do this in a way that avoids the disastrous planning errors around the Grand Prairie Hospital, which took twice as long as planned and went I think, twice over budget, 2 times over what the initial budget was. So we're determined to do this in a thoughtful way. That has meant, I'll be honest with you, I'm a get-her-done kind of guy, and I get impatient getting all these reports about endless consultations on the planning for the hospital. I just like to get shovels in the ground and rooms available ASAP. But that is a recipe for disaster when you're dealing with something as complex as a hospital. If you don't have all of the detailed planning done well in advance to know exactly what you're doing, so you avoid changes to the plans, that's where you get huge delays and cost overruns. So this is a gradual process. There will be shovels in the ground in the short term, and believe me, I will be pushing our departments to go as fast as they can because we need that capacity. We need it as soon as possible. But the important thing is the money is there. It's hardwired into the provincial fiscal plan, and so the planners know that the funds are there, and we will continue to encourage them to go as quick as they can. Vous voulez en français, Audrey?
Oui, s'il vous plaît,
okay.
Merci.
Écoutez, je ne peux pas... Excusez-moi. Je ne sais pas pourquoi le gouvernement de l'NPD n'a fait aucun investissement dans l'hôpital de Red Deer. Ils ont reçu cet avis et ils n'ont rien fait. Mais nous avons investi $100 millions au début de notre gouvernement pour faire toutes les planifications. Et aujourd'hui, avec 1,8 milliard de dollars, le plus grand investissement dans le renouvellement d'un hôpital dans l'histoire de l'Alberta et le plus grand investissement capital des contribuables dans l'histoire de l'Alberta centrale. Alors, ça va prendre quelques années de le terminer parce que c'est très complexe avec un hôpital fonctionnel, mais il y aura les travaux commenceront aussitôt que possible. Et moi, je vais mettre la pression sur les ministères d'agir aussitôt que possible pour ouvrir les lits dont nous avons besoin pour élargir la capacité de notre système de santé.
Audrey, do you have a follow-up?
Yes, and it's a follow-up on Ukraine, so I'll ask it in French. Monsieur le Premier ministre, vous avez été quand même très critique de la réaction de Justin Trudeau sur l'Ukraine. qu'est-ce que vous feriez différent et pourquoi est-ce que vous rencontrez les membres de la communauté ukrainienne aujourd'hui?
Écoutez, c'est une question de sécurité globale essentielle à l'Alberta. Nous avons évidemment une grande population des Albertains d'origine ukrainienne qui sont très liés à la situation tendue. Et M. Poutine il joue un rôle central dans l'économie et la sécurité de l'énergie globale, comme l'Alberta. C'est la raison pour laquelle je crois que le fédéral doit prendre plus au sérieux la situation avec les sanctions plus graves pour envoyer le message que le Canada n'acceptera jamais cette invasion, effectivement, de l'Ukraine, un pays souverain et démocratique. Alors, à cause des liens humains et historiques entre l'Alberta et l'Ukraine, c'est important d'exprimer notre solidarité. C'est la raison pour laquelle ce soir, je vais rencontrer le consul général de l'Ukraine en Alberta et les leaders de la communauté. Je vais annoncer une subvention pour aider la société civile en Ukraine pendant cette crise. Et c'est la raison pour laquelle j'encourage le Premier ministre d'appeler le président Biden pour souligner que la décision d'annuler l'oléoduc Keystone XL a aidé M. Poutine avec ses richesses des exportations de pétrole aux États-Unis. C'est une question de sécurité énergétique globale dont l'Alberta joue un rôle important et j'espère que nous profiterons de cette occasion de souligner que l'Alberta peut remplacer la Russie dans les exportations de pétrole.
Thank you, everyone. That concludes the press conference.
Thank you.